less than 50 these days. In fact, in some of the studies that I do, we see patients being diagnosed at age 24, age 25. It's becoming a huge problem. We just recently published a study looking at national data in the United States, looking at breast cancer. And we saw a massive rise in breast cancer in women under 50. Last year, more than 247,000 women were diagnosed with premenopausal breast cancer, that is breast cancer before the age of 50. There is an annual increase in about 3% annual increase in the number of women aged 20 to 49 developing breast cancer. This cuts across several other cancer types as well. A recent study published shows that the cancer risk in this generation, I think this is Generation X, or is it Gen Z, is much higher than previous generations. So there's so many factors that are driving the increase in young cancer in young people that we need to address. Cancer is a mutation in our cells brought about by repeated divisions. Our body finds a way to clear those mutations, but over time, as those mutations accumulate, our body's defenses and ability and capabilities to clear those mutations decrease over time. That is why initially, for instance, in a 20-year-old person, among 20-year-old people, the risk of getting breast cancer is 1 in 800. That is, if you look at 20-year-old people, the potential, the probability for a 20-year-old person to get breast cancer, out of 800 people, 1 of them will get breast cancer. As people get older, that proportion and that risk reduces. Among women aged 75, the risk of breast cancer is 1 in 8. That is, at the age of, if you put 8 people together, 8 75-year-old women together, 1 of them is likely to develop cancer. So as people age, the risk of cancer increases. What we are finding is that biological aging is increasing in younger people. As biological aging increases, the risk to several chronic diseases also increases, and cancer is a chronic disease. So that's why there needs to be a lot of focus, a lot of attention on trying to understand some of the risk factors for cancer and trying to see how can we address this. Dr. Olagbegi has touched on some of them, but I'll try to reiterate some of the ones that we focus on. Again, there are several reasons why people develop cancer, genetics, lifestyle factors, and other things within the environmental factors as well. Some people develop cancer for reasons we'll never know. That's the truth. Doing some of the things I'm going to talk about does not mean that the person who does all of them would not develop cancer, or the person who does some of the lifestyle factors that are known to promote cancer will develop cancer, but they just help to mitigate the risk of cancer. This has been shown several times over and over, and they do work. So I'll touch upon 8 things that we that we have seen from studies to work efficiently well. And at Sightman Cancer Center, we do encourage people to try and abide or live by some of this. The first one I'm going to talk about is maintaining a healthy weight. Obesity, BMI, body mass index greater than 30, is a risk factor for cancer. It increases the risk of 13 different types of cancer: endometrial cancer, colorectal cancer, postmenopausal breast cancer, ovarian cancer, multiple myeloma, and several others which I don't want to mention. So having excess body fat, body weight, increases the risk of cancer. If you're already overweight, of course, there are ways that you can either reduce your weight. It can be challenging, but the first thing is to ensure that you don't gain more weight, and also begin to put in place efforts to shed or reduce that weight. The ideal body mass index should be less than 25 kilogram per meter squared. Overweight starts being between the ages of 25 to 30. We also know that several factors impact body mass index. We know that people that are metabolically obese and are healthy, and we know that other people are metabolically not obese but are unhealthy. So we need to take into consideration all this, but the goal is to maintain an ideal body weight. That reduces the risk of cancer. The second thing I'm going to talk about is maintaining physical activity. A very physically active life reduces the risk of 14 different types of cancer. Physical activity reduces cancer risk, first of all, by reducing obesity. That's one. It also reduces cancer risk through other mechanisms that are not related to reducing body weight. Physical activity promotes several biomarkers within the body that have been known to reduce the risk of cancer, such as adiponectin. It also reduces the several biomarkers that have been shown to reduce the risk of cancer, such as C-peptide, insulin, and also and leptin as well. So being physically active works in two ways: reducing obesity and body weight, and also promoting several biomarkers and hormones within the body that reduce the risk of cancer. The question is, how much of physical activity do we need? Having 30 minutes of moderate physical activity every day has been shown to reduce the risk of cancer by 45%. Physical activity doesn't mean that you have to be in the gym. There are several things to physical activity, and you can incorporate physical activity into your daily life. Dancing, walking after dinner, I can see Dr. Brimo dancing, walking after dinner, just really engaging in things that increase your heart rate over time consistently for 30 minutes every day will reduce your risk of cancer by about 45%. One thing that has also been found to be very effective, because we know physical activity can be very challenging, it can get very tiresome, so a lot of people avoid it. You can incorporate it into some of the things you enjoy. As a family, you can go to the park together, walk around the park. After dinner, you can just walk around, take a long walk. You know, all those things work. You don't have to go to the gym to be physically active. Avoiding alcohol, as Dr. Olagbege has said, is a very important way to reduce your risk of cancer. Alcohol intake increases the risk of 7 different types of cancer. For every 2 glasses of wine you take every other day, your risk of breast cancer increases by 20%. That's the truth. That's the hard fact. Your risk of esophageal cancer increases by 25%. So cutting out alcohol is a very sure way to begin to reduce your risk of cancer. One of the challenges we had with public health messaging in the past was several cardiovascular studies from cardiovascular disease have shown that alcohol intake reduces the risk of cardiovascular death. While that is right, the important thing is to be able to balance your intake of alcohol between your potentially mitigating your risk of cardiovascular diseases and potential impact it would have on cancer risk. So if you do drink alcohol at all, try as much as possible to minimize it. There's nothing wrong in enjoying an occasional glass of wine every week or maybe every month, but avoid taking alcohol consistently. If you do smoke, one of the best things you can do for your health is to stop smoking. There is nothing as carcinogenic as cigarette smoke. Cigarette smoke contains 600 different types of carcinogen in just one cigarette smoke. So cigarette smoke, there is virtually no cancer type that cigarette smoke does not, smoking does not increase. So one of the ways you can prevent or reduce your risk of cancer is by stopping smoking or by not engaging in smoking at all. If you do smoke, that's not the end. You can stop. Studies have shown that if you stop smoking, your increased risk of cardiovascular disease reduces back to normal 10 years after you stop smoking, and your elevated risk of cancer reduces back to normal 12 years after you stop smoking. So while you may have started smoking, stopping is a sure bet to start reducing your risk of cancer. And there are several ways. We know that smoking is addictive. There are several ways you can quit. If you cannot do it by yourself, there are several quit lines, professional opportunities for you to engage in quitting smoking. The fourth thing I would like to talk about is diet, maintaining adequate diet. A diet rich in fruits, vegetables, grains, all wheat is very, very healthy. And if you can incorporate this into your life every day, into your diet, it does help to reduce your risk of cancer. Avoid diets that are heavy in unhealthy fat. I know that as a community, there is a tendency for us to engage or use fat a lot. So we want to be sure that the kind of fat that we use, oil, are the healthy type and not the ones that increase the risk of cancer. Number 6, sexually protect yourself against sexually transmitted infections like HPV, hepatitis B. They increase the risk of either cervical cancer, hepatitis, and also liver cancer. So one thing you can do is by protecting yourself, and there are vaccines to protect against cervical cancer. This may not apply so much to us, but avoiding exposure to the intensity of the sun increases the risk of cancer. Reduces the risk of cancer, skin cancer especially. The risk of skin cancer and melanoma is not so much in black people because of our melanin, but we also are at risk of developing melanoma and other types of skin cancer as well. So in as much as possible, avoid undue exposure to the sun, especially between 10 and 4 p.m. If you do need to be in the sun at that point, make sure you use protective measures, sunscreen, wear a hat, those reduce the intensity. The last but not the least is for you to get regular screening for cancers that we know that screening works. At age 21, screening for cervical cancer. At age 40, get screening for breast cancer, especially for black men. What a lot of studies have shown that black women before the age of 40 have a 53% increased risk of developing breast cancer compared to any other race in the United States. So if you're black, if you have genetic mutation or genetic risk, such as BRCA mutations, it's important for you to talk to your primary care physician or to your geneticist as soon as possible so that you can start screening even before the age of 40. At age 45, get your colorectal cancer screening, and at age 50, get your lung cancer screening. All these 8 ways, we try to make it as easy as possible. Adopting these 8 ways, engaging these 8 ways, is a sure way to reduce your risk of cancer. That does not mean that your risk of cancer is eliminated, but it reduces dramatically. I think it will probably be easier and better for us to engage in other things and ask questions. I'm happy to take any questions, provide more insight and more clarity, because this is such a huge topic that cannot be covered in just a 20-minute discussion. So happy to take questions and happy to engage in more. Thank you.
My apologies. Thank you, guys. We are very, very fortunate to have such a wonderful panel here today. This is like, 150 years of medical experience. Thank you all for coming. And I wanted to leave room for the group if you have questions.
Thank you so much. My question is, now on social media, they always like, don't eat this. If you eat this too much, I know a lot of people are tired. Me, myself, I'm so tired of giving my kids, don't do this, don't use plastic, use, it's confusing sometimes. And we don't want to get all this disease so as our children. So now that I have the opportunity to be here today to see you guys, can you shed light on these things? Because there's so much, and there's so much fruits that don't eat this, and it's confusing. Can you please shed light on it? Thank you.
yes, social media, computers, there's a lot that come at you. There's also a huge industry out there. People have reason to want to sell stuff and not sell stuff. And then people without scientific background, just because they have an audience, they can push stuff. And unfortunately, some of the studies have yielded conflicting results. Like, for instance, coffee. There are studies that say that if you drink excessive amount of coffee, it protects you from colon cancer. But then when they do additional studies, it doesn't bear it out. So there are some things that are clear, though. So let's deal with the clear stuff, and then the ones that are on the margin, you can just use common sense as a parent. So for instance, we all agree that red meat, excessive consumption of red meat daily is a bad thing. It's bad for your cholesterol, it's bad for the heart, it's bad for colon cancer, it's bad for a lot of things. So the clear things that we can agree on, I would like for us to stick with that. So red meat, alcohol, cigarette smoking. Fiber is most of the time, when you talk about high fiber diet, a lot of fruits and vegetables. In doing my research for this talk, I did not come across anything bad about consumption of fruits and vegetables. So it's safe to stick with that. Now, a child or an adult may not like one particular fruit. That's okay, you just supplement with something else. But so fiber, fruits and vegetables, avoidance of red meat, avoidance of, so I'm a coffee drinker. I drink a couple of cups a day. So, but excess of anything is bad. Even the Bible tells us that. So, Pastor, I'm on the pulpit, so I'm not preaching. So excess of anything is bad. I mean, if I tell you to eat a lot of fiber, I also know as a gastroenterologist, if you consume too much fiber, you start having bloating, gas, and then you come back to me the next day and say, I'm bloated, my stomach hurts. So excess of anything is bad, but things we can agree on, I will stick to. Like you said, in the cardiology literature, they say a glass of wine with dinner is good for your heart, but it's not good for cancer. So again, it boils down to moderation. Thank you.
I totally agree. There's so much misinformation out there, and that's actually an active area of research. How can we reduce the amount of misinformation, especially when it comes to health, so that people can have access to real facts? Yes, you're right. There are some spaces or some sites that I'll say if you go there, they would give you peer-reviewed facts, so you can at least believe what some of the things you read there. The National Institute of Health website is a very good site to look for matters related to health. The National Cancer Institute website is a very good site if you're looking for really good information on diet and health. The CDC also has buried in its site several layers on several dietary factors and how that relates to health. As Dr. Lagbegi said, some of the things that we've talked about are proven and some are still not certain yet. So the question is, it's better to stick to things that you know work, and at least if you're not sure something is healthy or not, it's just better to avoid it until you're certain that this is either good for you or not good for you. Vegetables and fruits, there's nothing bad in them. Again, in moderation, as part of the prevention and control program at Sideman Cancer Center, we try to provide outreaches on diet every month. So we write columns in newspapers. So if you go to the St. Louis Post-Dispatch, I think the last Saturday or last Sunday every month, you see articles on diet written by the prevention and control program at the Sideman Cancer Center. So I have written quite a few this year. So that's an avenue for you to see how what you eat every day could potentially impact your health. I think the last one, the one for July is going to come out probably next week, and I wrote that, and it's looking at the role of tea consumption in health. So I think there are certain areas where you can get really peer-reviewed information, because a lot of problems is that one study gets done, but no study is definitive. And as Kayode here will probably tell you, he's working in that space as well. He's done some work when he was at WashU. You do research, but no one research is ever definitive. So you have to see the quality of the research and look into how well done the research is. And then when you put a lot of studies together, you can actually see, okay, well, looking at what they've done, how can I trust the information coming out of it? And that's why a lot of people or a lot of researchers have to synthesize results from various studies. And that's why a place like the NCI, NIH, that's where you can get really high quality research results.
Great, so these gentlemen have answered the nutrition-related question. I think I want to kind of angle your question from the standpoint of mental health. Social media is impactful and influential in our lives in more ways than many of us parents take the time to understand. I had a conversation with one of my children that really suffered from bullying, and I had no idea. You know, I was bullied in high school, but you know what? I got off the bus and I left Johnny behind. And that's not what happens in this day and age. You are in your home and you don't know how many other people are inside your home interacting with, engaging, persuading, dissuading, antagonizing your children. So from the standpoint of social media, I think it's important as parents to, one, try to understand what's happening in social media, be part of social media. I wouldn't, if you asked me this like 15 years ago, I'd be like, no, I'm not a Facebook person, I don't care for this or that. But you won't know what your children are exposed to if you're not there either, to know what's going viral, what is it that they are talking about, what are they seeing. There's a great deal of bullying that happens, so encouraging our children to talk with us when they feel that they are being bullied, so you can give a different perspective, give some supportive advice, let them know that they're not just kind of out there on their own. There's a lot of self-perception or distortion of self-worth or even our physical appearance that our children face and are exposed to constantly on the internet. And especially as African or African American people, I'm looking at some of these images. I'm like, okay, so when did we get to be so slender in our waist or whatever in terms of what our children get exposed to? And I think about one story with one of my daughters. We were taking ballet. And I think the last month I spent in ballet was when I was watching, and the ballet instructor was telling my daughter to tuck in her stomach and scoot in her butt. And I'm like, that's never gonna happen. So we just need to get out of here. So that's in real person, but this kind of stuff is happening on social media and the internet all the time. And if we're not part of it, we don't know what our children are engaged with. You know, one of my children, we have a constant dialogue going on social media where I'll see something that I think is beneficial or useful, like Sidney Poitier, the actor, got thrown out of his first audition, and he could barely read. And he said that was what inspired him, that I'm going to be the best actor. I'm going to go learn what acting is. So I shared that with my son, right? So we have different things that we're conversing on, so at least I know what he's exposed to or what he's thinking. Be a follower. They might try to block you, but if you try to not, you gotta grow a thick skin. I don't react to everything that I see them posting. I learn not to, because getting blocked, you can't see what's going on. And like I said, some of our kids will have 10,000 followers, and shit is going down, and you don't know it even though they have followers. So if you're one of the followers, you'll be in the know. Oh, I'm in church, I'm sorry.
Thank you so much to panelists. My name is Kayode Matthew, and I want to ask a question based on my background in public health. I see from my little experience and with my experience with research with Dr. Toriola, I have known that the fact that certain individuals have access to health insurance does not mean they actually would have access to quality care. Does not mean they will use their health insurance to actually seek care. So I want to ask this question. Let me say maybe particularly to Dr. Olagbegi. From your years of experience, what list of items would you take as the barriers to the uptake of colonoscopy, aside from health insurance? That's the first question. Now the second would be, in what ways do you think the church like this could actually come in to improve the uptake of colonoscopy, particularly among black people in this community? Thank you.
That's a good question.
Thank you so much for your question. It's very insightful. In my experience, I've been in practice here in St. Louis since 1998, and that's been a while. For even people that have health insurance, I'll start with a personal experience. When I was in New York before I came to St. Louis, I was going to do a pre-employment physical at the VA, and the doctor says, Dr. Olagbegi, you need a rectal exam. I said, no, I don't need a rectal exam. I was 35 years old. I said, I'm 35, you're not going to do a rectal exam on me. So young people, healthy young people, with or no, without insurance, if they're healthy, they usually don't feel the need that they needed to be evaluated. So that's the first thing, and that's very permissive, even more so in the black community. I have a lot of barber friends that I visit with. I have a lot of nursing friends that they will bring their significant other, their boyfriends and their husband, and say, hey, go see Dr. O. Go get your colonoscopy. And they say, hey, nothing wrong with me. And it's the same thing back home in Nigeria, where if people are not sick, they don't go to get health care. So you could have the best health insurance. If you don't feel the need, if you don't understand the need for screening, a lot of people don't come out for screening. So the church, it will be a very, very good place to start. This kind of program will be very helpful. The more listeners we have, the more community that we sit down together and talk about the importance of screening. I think almost every condition that I can think of benefits from early detection. Almost every, even back in the day where brain cancer, glioblastoma multiforme used to be deadly, now you find it early, people are surviving. So we just need to get the word out that early detection is most important, whether you have insurance or not. Then secondly, a lot of people with insurance cards in their pocket, even provided by the employers, don't have primary health providers. They don't have a family doctor that they go see. They change the oil in their cars every 3 months, but they don't go to the doctor for years. So I think that's a place to start so that everybody understands. Just like he said, their screening starts at 25 for certain illnesses, at 45 for some, at 50 for some. Everybody should get screened. And I think the church would be a good place to start. I don't know if I answered your question. Is there any other part to it?
So I wanted to address one aspect that stood in my mind about your question. You talked about access and distinguished it from utilization. Being a card-carrying member of a country club or a gym and you never go, right? And so I think one way that we can do better in that, one, as healthcare provider, one thing that I'm cognizant of just in my day-to-day practice is acknowledging, respecting, and communicating with caregivers. If I see a man come into the office, new patient, I will often jokingly ask, so is this a hostage crisis? Do we need to write a note to your wife or your significant other that you actually came to the doctor today? Because some of them, the instruction is, I made you an appointment. If you come home without actually going through with it, you're in trouble. So kind of acknowledging the value proposition of those that are encouraging them to come. In regard to mental health, that question is so critical because there's some aspects of our policy that actually make it more difficult for even the people that care about you to help you, right? So if someone has colon cancer, their mind is still intact. They can make decisions. They can tell the people that care about them how the state of their condition, what's going on, how they could be helped. And they have privacy rights. They have to tell you that when someone may be having a mental health exacerbation, they might be psychotic. They might not be able to make decisions, but they still have the right to not tell anyone. So it's not unusual. I've been in situations where I'm going into work and I see a family coming for visitation every day, and every day we're having to turn them away because their son, daughter, wife, or a significant other does not want to see them, even though they are not in that corrective state of mind. And so there tends to be a break in terms of what the caregiver can do to be helpful. But when the window of opportunity comes, I think as healthcare providers, we need to get caregivers engaged, give them as much information as they can get to be able to be helpful to their loved one. Also, from a public health perspective, there's a lot of resource that we have in Missouri, in the US, social workers, case management. There is opportunity for much improvement in those areas, particularly in the area of mental health. It's so complicated. Even if you have access, actually getting to understand how to use your Medicare or your Medicaid. We have patients that just get rolled off Medicaid because they didn't turn in that administrative paperwork that says, I'm still psychotic. How am I going to tell you I'm still psychotic? I'm psychotic. And if my family don't understand, if my family are not empowered to be part of my support system, then it's really left to that government-appointed social worker. And we have so many social workers that are taking clients out to lunch, but they don't know what the state of their insurance is. They don't know whether the Medicaid form has been turned in or whether the workplace is harassing them as compared to giving them the due rights that they are entitled to by law. So as professionals, there's much that we can do to actually understand our patients, meet them where their needs are, and also understand that we are not alone. There are caregivers that care, but when they're not empowered. And if we educate them as to how they can be more beneficial to those that they love and are trying to care about, we can get much further with our patients, and we can also avoid the crisis of caregivers falling ill, being overwhelmed from trying to do so much with so little.
Thank you, guys. So I'll quickly share my own personal experience. Access versus utilization. That was a very good question. One of my classmates from medical school, she's in London practicing medicine, and her mother died from breast cancer. By the time she was diagnosed, she was already stage 4. So you wonder, right? Your daughter is a doctor, and she never had a mammogram, like in her whole life. And my mom was here. No, she was in England, and they were doing free mammograms, and they sent notification. And she called me, and she was like, who told these people that I'm here? They want me to come and do a mammogram. I'm not doing no mammogram. And I was like, Mommy, they are offering you free mammogram, something that people are struggling to get, and you don't even want to go. Oh, no, I'm not going to go look for trouble. So it took so much convincing. She actually didn't do it that year. It was the year after, because I stayed on her case. It was the year after that she finally did her very first mammogram. So access and utilization. So I'm going to allow, we are supposed to be done by in 10, 15 minutes. So we'll make it really quick. I'll take your question, and then we'll see if we have any more time. We have to take Pastor's question.
Thank you. My question is regards to the mental health aspect about seeking help. So at what point do you look out for help? Is it when you begin to observe some things in the children, or even as an adult? What do you watch out for as symptoms to prompt you to want to seek help? Or it should just be taken as a primary care aspect?
So in terms, we talked about screening. We actually do screen for mental health in primary care practice. So the PHQ2, PHQ9 are routine screening for depression. In terms of what one can look out for, behavior changes, attitude changes, things happen, right? You know, there's a loss in the family that we all experience, but somehow sister's not getting up and doing the things that she usually does. That could be a sign that you want to reach out to your sister, talk with her, talk about what you observe, encourage her to get the attention of her doctor in the same way she would have gotten for her diabetes. And I think that question that you ask is also important from the standpoint of pediatrics. I'm not a pediatrician, but what I do observe from experience is that not everything is attention deficit disorder. Many of our children are getting misdiagnosed with things that they don't have, when in fact it could be the early beginnings of more serious things that need different treatments, such as early onset of schizophrenia, bipolar, things that can definitely be impactful on the development of the child to their potential. So in terms of what you might look out for, not every bad behavior is a bad kid. It could just be that, you know, an adult has credit cards, so they go shopping and buy everything that they don't have money to spend. A child might just be acting out in school, sliding down the school banister. Why would you do that? Well, my mind was racing. You don't know. So behavior change is not all, that appear offensive, especially when we talk about stigmatization. High blood pressure doesn't speak out and shout at you, right? So a child that is usually mild-mannered, respectful, all of a sudden is more belligerent, aggressive, rude, that might not be bad influence. That could be mental health that is beginning to blossom in ways that are yet to be understood. So not casting everything as bad behavior, needing corporal punishment, as opposed to really trying to get underneath as to what is this behavior that I'm seeing? Why is this behavior that I'm seeing? And recognizing that just like you can go get your child help for their asthma, there's a broader diagnostic consideration that should be given, especially for young people when they're presenting with behavioral concerns that could end up to be mental health and not just simply a bad kid.
If I may add to that, I'm sure time is against us, so this conversation can be ongoing for a long time. I agree with what she said, but just to put this on the table, it's probably easier when the subject is a minor, where the parents can intervene and lift the cover and try to get additional evaluation. The school says this is ADHD or this is autism, but every parent has an obligation to go for further evaluation. Is this true? Is this not true? That way we can pick it up sooner than later. Unfortunately for adults, it's a little bit different, and I don't know the solution. I have people that I know, colleagues, people that I've known all my life who have mental illness, and very difficult to get an adult into treatment when they don't understand, when they don't have the insight that there's an illness. And I don't know the solution, but God help us to be continued.
Thank you. I have a comment and I also have a question. My name is Arinola, by the way, and this is my church, so you are all welcome. with issue of mental health, I have a challenge because in our community, we see a lot of children. And the first thing we do, and as a Christian, I would tell you, we go to prayer. But what other groups or resources can you share with us? We also have in this church a lot of international students and a lot of young people who have family in Nigeria or somewhere else, but not in St. Louis. So we are one of their support group. But like Dr. Lagbegi said, we don't have all the answers. So who can we turn to after praying that can also assist them medically? And I also say to young people here, for several years I worked in a finance department, and we'll encourage our young professionals to get medical insurance. It's expensive, costs a lot of money. The money that can go towards your mortgage or your car note or your travels, and many would opt out. I'm fine, I'm healthy, I'm strong, I don't want it. But there was a year in particular where we encouraged this young engineer, get life insurance. You can afford it. And she did, and that summer she was diagnosed with cancer. And she was at the hospital for 6 months, big bands for 6 months. So we are not getting health insurance because we pray for sickness. It's just to have it, just in case you need it. So those are the two things. So if you don't mind, Dr. Onifade, thank you.
So I think for me, I don't really see a distinction between science and my faith. And I am ready to pray with my patients. And I will often describe or explain that this is, my role as a physician. This is how God's using me. This is the opportunity that God has given me. And we're thankful for the work of the scientists, that everything is God's doing. So there's really no separation in my view. So with regard to that, then it's not really a either or. I have faith or I go see the doctor. You do both. It's the same continuum. You pray for your doctors to see what is necessary and to understand what they need in order to be able to give you the best care. What was your other question? I think I answered it. Resources. So one resource offhand, a lot of us think about the emergency department. You can go to the emergency department in the setting of crisis. There's also, I know DePaul, for instance, has a outpatient or urgent care that is specifically for mental health. So that's one thing. The unfortunate aspect of, how to help adults is for heart disease, right? I use heart disease as an example. We want to prevent that heart attack. We're not waiting for you to be having the heart attack to treat you. Unfortunately, in mental health, we still have a ways to go. So oftentimes the criteria for getting admitted is you are suicidal, you are homicidal, you are completely psychotic. And even if you are psychotic, you're not trying to hurt anyone. It's okay. Go on out there, you're okay. So that's where urgent care can be helpful. That's where the primary care physician can be helpful, because there are other avenues by which we can try to get patients and their families help. Even though we might disagree on the urgency, I don't think someone needs to be suicidal before you give them the attention that they need for their depression. You can have severe depression and treat before you get to the point of being suicidal. And a lot of times our mental health patients, get turned away. I remember one story, and I'll tell it really quickly. I called the ambulance from my office because I had a patient that was endorsing suicide. And I remember arguing with EMS. They said, is he okay? Can he drive himself? And I'm like, well, I don't really know if he's going to drive himself to the ER or to the railroad tracks. I am demanding an ambulance because I see a medical emergency here. His blood pressure may not be elevated, but I am fully convinced and very concerned about this situation. So yes, I am going to call EMS for that suicidal patient, okay? Because it's a life-threatening condition.
And I'm going to just quickly add to that. One of the partners here today, High Tech Charities, their mobile clinic is outside. They also offer mental health services.
Thank you very much. First, I have to take this opportunity to appreciate and thank our panel here. I mean, they are people of very, very high value, and you know, I don't want to talk about their salaries, and I have to inform you that we are not paying them today. So this is a voluntary for the community. On that note, I say thank you very much on behalf of the church. I really appreciate you. I have two questions. One of them is very, very tricky. I don't know, but one is easier. And the one is easier is what I'm going to say first. And that goes to the, usually goes to everybody, but particularly to the mental health. We talk about the access. Something that Dr. Onifade had mentioned, that when passing is that the access to Medicare in America is very, very poor. It's not, you know, I mean, it will be very nice if we can have a medical access that is easier for people to be able to. You need an insurance. Then an insurance, you need to pay a premium you cannot afford. And if you afford, you cannot afford co-pays and all those things. Or those kind of things make it so hard for people to access health care or medical care. They won't pay for this, they won't pay for this, they won't pay for this medicine, they won't pay for all those kind of things. And that is what I want to say, what we are struggling with in the healthcare department. And the serious thing, you know, especially, you know, coming from the pharmacy perspective, some patients won't take their medications because it's so expensive. And, you know, those are some of the ways that if we restructure it, this is the most, the country which is the, how do you say it, a country that has the highest capital in the world, and so we have those. Then the other one which I want to mention about is the healthcare in cancer. I want to ask a question. You may not really be able to answer it, or you may not know, or may not have the answer. I've been seeing recently that people with diabetes type 2 on insulin, I've been seeing some diagnosis of cancer, maybe colorectal cancer, maybe pancreatic cancer. I'm trying to think they are related. Can you shed any light on that? Thank you.
So yes, several studies have shown that having a history of diabetes increases the risk of certain cancers. And as you've rightly pointed out, colorectal cancer is one, pancreatic cancer is another. We're beginning to see that it also impacts postmenopausal breast cancer. And the reason for that is because diabetes causes insulin dysregulation. And insulin dysregulation impacts several other downstream hormonal pathways that causes cellular deregulation and also impairs functioning of cells, and that increases the risk of cancer. So that is true. Somebody with type 2 diabetes has an increased risk of certain types of cancer. And that's why insulin-treating medications such as metformin have been used in trying to prevent cancer, or even as adjuvant potential, I'll say potential because some of them haven't really worked out, potential adjuvant to chemotherapy at time. If you're following the literature, one of the biggest discoveries in the last few years is GLP-1 agonists. These are used to treat insulin disorders, especially diabetes, and there is very strong evidence showing that these medications that are used to treat diabetes and other insulin disorders also reduce the risk of several cancer types. One observational study, and I'm saying observational because it's important to distinguish between observational and clinical trials. findings from observational studies still need to be confirmed in clinical trials. But an observational study was just published 2 weeks ago, and it showed that these agents, the GLP-1 agonist, potentially can reduce the risk of 13 cancer types. And these are cancer types that have been known to be influenced by diabetes. So there is a very, very complex relationship between diabetes, treatment for diabetes, and cancer. That, So yes, you're right. Having an increased risk, having diabetes increases the risk of cancer. So what a diabetic person can do to mitigate their risk of cancer is to ensure that they take their medication very, very well and adequately.
So I agree with everything you just said. And in my quick presentation, is actually part of my notes that being diabetic is a risk factor for colon cancer. But it's not just diabetes. He just explained the metabolic syndrome. So metabolic syndromes in general, because of the increased insulin that comes with it. And so that's just one part. The other part is there are some people that are obese, may not be diabetic, but they have elevated liver enzymes. That metabolic syndrome is also a risk factor for colorectal cancer and pancreatic cancer. So your observation is quite on point. So it's well known.
So I think your other question is not just about mental health, but really the cost of healthcare. Healthcare is the single most expensive governmental expenditure in the US next to warfare. So there's a lot of push and pull as to how do we spend tax money. From the patient perspective and as a healthcare provider, I think it's important to be strategic and being educated about the different insurances that are out there and the implications is important. There is no shame in having Medicaid. In fact, if I had to prioritize the order of insurance that one should have if you're eligible, first, Medicaid gives the most support. Some of the inequities in Medicaid have been knocked out by governmental policy and law change. Before, a Medicaid patient would come to my office and I would get reimbursed nothing really compared to any other insurance. So of course, you know, doctors are not able to accept Medicaid patients, right? Because you're giving the same care, right? Your heart is the same, whether it's United Healthcare or Blue Cross or Medicaid. So if I was a consumer of healthcare, I'd first find a way to not be eligible for Medicaid before I start looking for something else. Then next, if you're in any way eligible for Medicare, find a reason why you're not eligible before you decline Medicare. There's a lot of confusion in the Medicare policy. You know, the Medicare Advantage plans versus straight Medicare. You know, I encourage my patients to keep it simple. You got Medicare, you don't know what other conditions you have, but you know what Medicare does. You might not know what your Advantage plan might do. Then really where it gets tricky is where most of us fall in, which is commercial health insurance. It really depends on what conditions you have. If you're a 28-year-old with mental health, I tell you, health-wise, you have the same conditions as a 70-something-year-old because that's simply what it's gonna cost to keep your depression from making you suicidal and to keep your psychosis from keeping you non-functional. And a lot of times we think about, I would say, bizarre disorders, the things that we wanna shun. And we don't realize that it doesn't, you know, mental health doesn't discriminate, you know, it's not that it's the drug dealer that is depressed or psychotic. It's you know, it's a genetic thing that any of us can have. So really, where I feel most concerned is when a young person has a mental health consideration. I really look to see if they have in any way to be eligible for Medicaid. Let them get it because the deductible for commercial is preventative. If you're yearly, so context, okay? A young person, typical healthy young person, they go get their physical once a year. They might need to play football on the football team, so they need to get. So who cares if my deductible is $2,500 or $3,000? But if I have mental health and my injectable is $2,600 or $2,500 out of pocket, and I first have to meet that deductible, you're not even going to get the first month. Even if it's going to be free the other 11 months, the fact that you don't have $2,500 in your pocket to meet that deductible, you're not getting care, even though you have a card. And so if you're eligible for Medicaid in any way, and then the other thing that I noticed or observed in studying some of these policies, laws, I love these kind of things, is that our government, just from being a clinician and being in healthcare, there's just so much to admire about how things happen. There's a lot that happens for us that we don't know. Medicaid, you got to figure out how to stay on, because you have that administrative hurdle of turning in your forms, seeing if your income eligibility and stuff. But things like Medicare, a lot of that stuff just happens automatically. We looked at your tax return, we saw that you are of a certain age or you have a disability and your card is in the mail. We calculated that you really can't afford your medication, so we've automatically enrolled you in extra help. So there's a lot of government policies and things that are happening. Where we can help our patients and their families is to educate them that these things are in fact happening. And this is where you can go to get educated about how you can help your loved one. And these phone numbers that you can call, you really can call, and people will walk you through the process because that is their job and that is the law. So the goal is not to save money because you don't have health care and then you're bouncing in and out of the emergency room, because we're all entitled to emergency care, but that's not where you want to be. You want to be in controlled care where you can continue to live a healthy and fulfilling life.
Thank you, guys. It is 1 o'clock, so I'm going to encourage anybody that has questions to meet with the panel privately, as I'm sure people are already dreaming about the barbecue. I really want to thank Dr. Olagbegi, Dr. Toriola, and Dr. Onifade. They are giving time here to us today to educate us. I know how busy they are. I know what their lives are like. And I know that we couldn't afford to pay them, even if we tried. And they have graciously agreed to do this for us. So I'm really, really thankful. Thank you, guys. So moving on, we are going to have 2 things going on at the same time, maybe 3. The expert cooks are going to start grilling and getting food ready so that you all can eat, drink, and be merry and eat healthy. Hopefully it's all healthy food. No red meat. And lots of fruits and vegetables. So they're going to be grilling, and at the same time, in the basement, we have set up tables there where you can have your blood pressure, pulse, your height, weight, those kinds of things, where you can come for screening. The battery died. So I will encourage people to, there's not that many of us, so there is time to get to everybody if everybody wants to be screened. So I will encourage us to just come. We're going to have somebody at the door that's going to usher you in. We want it to be orderly and organized. And there's not really a lot of stations that you're going to go through. So we're going to have people there ready to screen you if you so wish. Also, we do have some vendors here with us. We have High-Tech Charities. They are a mental health organization, charitable organization. They are going to be out there if you need any kind of mental health screening, you want to talk to somebody about mental health. They have licensed social workers that are here as well. And we also have a psychiatrist on site, if need be, that is here to help with that as well. We also have a table from a home health agency, Good Shepherd Home Health Agency. They are here to promote their agency. If you need home health care or you have questions about home health care, you can go to their table and talk to them, ask them questions. And my people are here from my clinic. I work at Dedicated Medical Center. We are a dedicated elderly care clinic. We take care of seniors, and my folks are here. Can you please stand up and be recognized? I'm sorry, I'm being selfish. But they're here from my clinic, so if you have any elderly person that is looking for a good clinic and good doctors to take care of them, please go talk to them. Did I leave anything out? You wanted to say something?
Hi, good afternoon, everybody. My name is Dr. Francis Onukwe, and I'm the president of High-Tech Charities. We are very grateful to Dr. Idowu for bringing us together, and we're also very grateful to Dr. Jones, and they have been working like hell, right? So, and we're very, very grateful. It is always a very beautiful thing, right, for very nice people to gather together. And we can't express enough how important our health is. So today we have a lot of resources together. From our organization, High-Tech Charities, myself, I'm here. We have a psychiatrist, we have our mobile clinic there. We have licensed clinical social workers, we have licensed professional counselors, we have administrators. So we are really prepared for all of you here. And you've seen very wonderful panel here, doing a lot of research, articulating knowledge, articulating ideas to make us to be healthier. And the pastor here putting all this together in a very comfortable place, very nice place. Dr. Jones have been working like hell, or we say heaven, like heaven. So we thank the Lord for all this. Use the opportunity that we are providing today. Go see a doctor, go see a clinician, grab a barbecue and make yourself comfortable. But most importantly, try to make friends. And I can see here, most of us are people who are very interested in our health, and it's very, very important. When you go back, share the information with others. And if you want to reach me, my name is Mrs. Onukwe. We have a number of open positions. Visit our table. Probably you will join us as a clinician, a psychiatrist, or any other professional in the hair care field. Thank you very much.
All right, thank you guys. So we're gonna go eat, drink, and be merry. Thank you.